D3b's mission for me is all about hope. Hope that I can tell a family that we're going to be able to cure their tumor. Too many times I have too many conversations with families, and no matter what I do, their child isn't going to live, or if they do live, they're going to have serious side effects from the treatments. And so what I see in D3b is hope that we can extend lives, limit side effects, and bring these families cures. That's what they desperately need, and that's what everyone in the center desperately wants to give them.
As a graduate student, really focused on molecules and chemicals, I had a chance to interact with Jay and some of the other residents in neurosurgery, and it was really just proximity, right? So much of science is just chance interactions, but they were down the hall. And I remember going for the first time into the OR, and they were doing surgery on a child, and removing a large portion of her brain. And for someone who was working in the laboratory with pipettes and beakers, suddenly seeing a real brain coming out of a child was transformative for me. And I remember asking the surgeons at the time, what happens to all that tissue? And the answer was not much at the time. And I remember suddenly realizing that there's potential to bridge the gap between what happens in the operating room and what's happening at the bench. So when Jay called up and said, would you like to come and do some of those things that we had talked about at Hopkins, it was really a transformative opportunity for someone like myself.
When I joined the CBTTC, now known as the Children's Brain Tumor Network, CBTN, back in 2014, I quickly learned of its amazingness and the tremendous work being done by a small group of people and those within the Resnick Storm Lab. It was only natural to elevate the success of CBTN and launch into something more grandiose across the rare disease landscape to save every child. The ride of these 5 years has been nothing short of awesome, seeing what each person brings to the table, the family that we've built to rally and change the traditional aspects of research. I look forward to tomorrow, next week, next month, next year, to see all of the wonderful work we will do and the continued impact that we will have, especially for our brain tumor kids. Thank you all for being a part of it. I've always said that this is the place where I need to be. That's still true today, and I look forward to working with all of you to help every child, every time, everywhere. Thanks.
To me, I'm really excited for the progress here in the center, to be able to increase our reach and be able to scale all the things that we do now and do them better and with more people across the world. Being able to touch the lives of these families as they work with us. They really are the people we work for. I think each and every person in this center is so committed to our families and our patients, and that really shines through in all of the work that we do. Everybody is so collaborative and open-minded to new ideas, to new ways to do things, and that's been just an amazing transformation to see us go from a team of 10 to a team of more than 80. And to see the transformation in how we do our work and how we've scaled has been really impressive to me.
Working with the patients and the families and the physicians, you can all see the moving pieces of how much the physicians and the nurses and everyone in the hospital are working so hard to give the children the best care possible. And I think The parents see that when you approach them to consent. They understand that, we are not forcing them to do anything, that this is just purely to benefit, the future of children with brain tumors. And sometimes there is no direct benefit for them at all, and they're still willing to help us. So I think that it means a lot for the families to be able to contribute in some small way if they can.
The center's mission, which is, for me, just a simple reminder that behind everything what we do, behind every daily task I do, there might be something more meaningful. There actually might be something way more important than this one task. And just brings me this hope, small hope that this work will be meaningful. I've seen us grow from small group, and I'm really proud of every project literally we started, we built, or we just supported. Liquid biopsy is personally something what I'm extremely thankful everyone who take part of it, and it's only thanks to your hard work. I'm actually considering myself lucky because I think my job is fulfilling part of my life. It's not only my job, and I'm extremely excited about next few years. I'm excited especially about acceleration of the bench to bed part. I think we are already tiny part of it, and I see we will be larger part of it, and it excites me a lot. So thank you very much for letting me work with you guys. Thank you for being part of D3b, and go D3b.
Working on the EXO-1 effort with the rest of the team at D3b. It's been amazing to see all of the work that went into getting the grant approved, us being awarded the grant, and getting the samples ready with the BioRC, and enabling the submission to the Brood for sequencing, one of the largest whole bank sequencing projects.
On the challenging days, where we're running a mile a minute, we've had a letdown or something fell through, I find it helpful to remember what we're doing. It doesn't get more important than saving children. And wouldn't it be cool if we could do it? That's what I'm looking forward to.
I just wanted to take this time and thank the team for another amazing year of hard work and dedication to building platforms that help researchers find cures for every child everywhere. We launched the Kids First Data Resource Portal in 2018. We spent all of 2019 recruiting users and supporting the researchers to use that portal. That portal now has over 2,600 users and over 50 research projects that we support on a daily basis, all the way from sequencing tracking to data delivery and public release. And that's been quite the rewarding experience to see that entire project go from absolutely nothing to this amazing ecosystem of rich research data. Happy 5-year anniversary, D3b. Happy birthday. And here's to another amazing 5 years.
With a mission like ours here at D3b, it makes it so easy to engage so many different kinds of partners. From individuals and patient families who are eager to identify cures collaboratively for their family or for their kids or kids like them, to research institutions and researchers who want a new way of finding cures and accessing data and resources, to donors and companies who want to collaborate with us. There are so many ways to engage. So, I've always been inspired by collaboration and the idea of people coming together to do something that's bigger than something they could do alone. So the idea of people working together across continents and across disciplines to serve children no matter where they are in the world every single time, and to do it faster than ever before just speaks to me on another level. It's amazing, and I'm inspired daily. I think we're going to make some really amazing progress and show that science can be done in a different way, and that it doesn't have to be about individuals or egos, but it's about the collective. And I think we're going to do it.
To me, there are several key words when I think about D3b: collaborative, patient-centric data sharing, and make direct and real impact. So one thing I've learned from working in the center is that to face the problem is almost always a better solution than ignore it. I know we're all great people. I know we will keep growing. And I know we can address any challenges by working as a team. So as the next phase, I'm most looking forward to keep working with you on every aspect, including research projects, clinical trials, and the D3b team buildings to make the center a better place and also to make everyone a better self.
I think everything that we've been able to accomplish being here for 5 years, having such an amazing team, and through that being able to empower the research that we're doing, that makes me feel very, very proud. The connections, the collaborations, the partnerships with families, with patients, with clinicians, researchers around the world. I'm absolutely looking forward for the clinical impact that we are having and that we're going to have in the near future. I look forward for the day that a child is cured because of the work that we're doing, and that we're able to cure, pediatric cancer, make better treatments, really, really bring hope and cures.
I love our mission statement because it reminds me to zoom out and to think bigger. The work happening here and with our partnerships isn't just about kids at CHOP or in Philadelphia or even the US. Our successes can potentially impact the health of kids all over the world.
We're focused on not just, trying to help kids here in Philadelphia, but kids across the country and across the world. And, seeing and working at a place that has that global impact from all these different projects that have these collaborators around the world is really powerful. It really shows that our work has such a huge impact on kids everywhere.
It's been an incredible journey with D3b because I think from the beginning, we started with our mission and our vision aligned to helping patients. And I think through that, D3b has developed not only a new way to do accelerated research for children, but also a new way to develop each one of us. All of us have grown within D3b, and it's been extremely gratifying to see people rise within their careers from where they started to where they are today. And I truly believe that is because we're aligned in that core mission. D3b's success is because of each one of you. We are disrupting systems. We are developing new practices. We are changing the landscape, and that can only be accomplished by people like you. Because of our mission and the drive to help patients, married with people that are open to new ideas, that are open to innovation, that are open to trying and failing, we have succeeded together.